Welcome to From Delco to Harrisburg with Representative O'Mara. I'm your host, Morgan Dougherty. Jen O'Mara represents the 165th District in Delaware County and is diligent about meeting with her constituents and addressing their concerns. Then she's off to Harrisburg, where she works to enact the change their community needs. Today, we will be discussing just some of what Jen is currently working on, including the PA state budget and a very important legislation concerning the affordability of fertility treatment. Thank you for being here with us today, Jen. How are you?
I'm good. How are you?
Good,
Thanks for
good.
having me.
Of course. So before we get into some of the things that you're working on today, I wanted to get a little bit of background as to what brought you into politics. How did you choose this career path for yourself?
It's a good question, and one I sometimes still ask myself, because I really never intended to get involved in politics. It was after the 2016 presidential election that my husband and I felt a need to do something. And my husband's a combat veteran, so at first we talked about him potentially running for office, and he was like, no way, I've already served my country, you're going to now. And so he was very persistent for a couple months and convinced me to do this. And he said it was because he thought my lived experiences would serve an elected official well. And what he means by that is the things that I've gone through before running for office. When I was 13, my dad, who was a career firefighter in Philadelphia, died by gun suicide and left my mom, who is a now single mom of 3, to take care of us and find a job. And she hadn't worked in 15 years and had a high school diploma. And so if it weren't for things like public schools or CHIP or my dad's union pension or my mom finding a job as a school bus driver, which is a union job in Delaware County and Upper Darby, we wouldn't have made it. And so after that election, it felt like our elected officials just didn't get it, what working families were dealing with and the different challenges that were there, and that government's supposed to be there to help and provide support when needed. So I decided to go for it. And I didn't know if I'd win or not, but I felt like running and spreading that message was an important one to send to people who are normally left out of the conversation. And so we made that jump and went for it in 2018.
Yeah, that's extremely admirable, and it's so important to have somebody in office that understands the struggle of a working family. So can you touch a little bit about what your main focuses are now as a politician, and have they shifted since you began your career?
Yeah, well, yes and no. So the things that I focus on include advocating for public ed, including higher ed and trying to address student debt, mental health in all of the different facets of our lives that impacts, and trying to make life more affordable and more, can't think of the word that I normally use. I want to provide working families with dignity. And so that in looking at life or policies under that lens sort of helps you figure out your stance on different issues or the things that you want to focus on. COVID has shifted it a little bit in that we still need to work on public ed. Mental health is still probably even more so now an accepted issue to talk about. But now we have to figure out how to restart our lives and our economy in a way that is, I think, beneficial for working families. So that means we have to change things, right? We can't just go back to the status quo. I think we're at a unique time in our history and in our lives where we can reflect on what was working, what wasn't working, how that's been exacerbated and highlighted by this pandemic, and what we can do moving forward to make things better.
Yeah, absolutely. And how is that going from a Harrisburg perspective, from our leaders?
I wish I could say everyone thought like I did, but then we wouldn't have a government that's representative.
Right.
Some people seem to have that same mindset, and others are really just focused on getting back to things as they were. And I think that's probably because people were really uncomfortable and forced out of the life that they were used to and the routine that they were used to. So I understand that desire, but we haven't seen as much transformative thinking as I wish we were doing right now. Mm-hmm. At the state level, I can't say the same for the federal level.
Right.
I think there's a lot of great things being discussed and going on at the federal level, and I applaud that work. But I don't think things are lost. I mean, we are still working on some things in a bipartisan way, and I think we all agree that we need to figure out how to get people back to work. And we may be looking at that from different lenses, but we have the same end goal. So I hope that means we can at least accomplish something good.
Yeah, and we're gonna touch on the state budget that you've been working on. But one thing that you mentioned was getting people back to work and noticing what isn't working from before. And have you talked about raising the minimum wage? Because I know a lot of people, there's a worker shortage, it seems. Nobody wants to work because they're living off of that extra $300 on unemployment, and if they can make more on an unemployment than working a 9-to-5 job, that'll be an issue.
Well, and I challenge that idea a little bit in that, yes, I think people right now are utilizing benefits. However, I think going back to work isn't as clear cut, and I think about that in terms of childcare, especially for families or single moms or whoever is struggling with the notion of paying for a kid to go back into childcare. That's very expensive. And so if you can't afford to work and pay for childcare, that may be a reason that someone's staying at home. So I think there are more reasons. I've also been hearing from folks that worked in perhaps the service industry, and I used to work in the service industry, but that they want a more solid job in case this happens again. So I think there's also fear in that way. But I do think wages are an issue. We are talking about raising the minimum wage in Pennsylvania, not straight to 15, but to 12, with a gradual increase to 15 over the next couple of years. Last session, a minimum wage bill passed. It didn't get us quite to 12. It would have raised minimum wage to $9.75, I believe. But unfortunately, it only passed in the Senate and it died in the House. There are still a lot of folks who believe minimum wage isn't the issue. We don't need to raise wages. But I don't think they're thinking about the economy in the entire circle, if that's their mindset, right? Raising wages is going to help people pay for things, put money back into the economy, and help get people back to work. So that has been something that at least the House Democrats have been working on.
Yeah, absolutely. It's a bit of a cycle. So what were some other parts of the budget that you focused on while you've been working on it?
Well, the budget is not passed yet. And so I'll explain a little bit about how the budget works in Pennsylvania. It is due June 30th. By an order of our Constitution, it's due June 30th of the fiscal year. It must be a balanced budget, which means we cannot end in debt. It has to end either balanced or with a revenue. And it is worked on not just by the General Assembly, but by the governor's office as well. So the budget process starts in February, usually by order of the Constitution. It's the first Tuesday of February, when the governor visits the General Assembly and has a joint session of the House and Senate, and he gives us his budget address, which is basically him laying out what he wants us to pass in a budget. Then over the next couple of months, there are appropriations hearings where the House and the Senate Appropriations Committees meet with all the heads of the different agencies in Pennsylvania government to get an update on their budget, spending plans, what they need for the next fiscal year. Then that takes us to about May, which is where we are now. Now we start having negotiations between the House and the Senate, the Democrats and the Republicans, the governor and the General Assembly. So there's a lot of different moving parts and conversations. We will most likely not see an actual draft of the budget until June, and then it will be worked on until it's passed by the end of the month. We're there almost the whole month in Harrisburg in the month of June. So my priorities have been focused on not cutting essential services, because unfortunately that is being discussed, but it doesn't seem to me like now would be the time to cut things like related to healthcare or senior care or schools. We're trying to prioritize how we spend the money from the federal government that we talked about in prior episodes. Through the American Rescue Plan, we're getting a large sum of money. So we want to see that plan invested into things like hazard pay and childcare and schools and small businesses and different elements of our economy that are going to help us recover. And so there is a plan for PA that our caucus has proposed. You can go online and check it out. But that is what we want to see happen. We will see what the final budget looks like. And then when it comes down to voting on the budget, it isn't one simple yes or no. We get the first version of it is the general appropriation, and that's basically the framework of how it will be spent. Then we pass fiscal codes, education codes, health codes, all different other budget bills that actually authorize the spending of the money. So there will be a whole series of votes surrounding finishing the budget. So it's a very complex process. Yeah. This will be my third budget season, and I feel like I'm learning more and getting to be more involved as each session goes along.
Yeah, definitely. Are there a lot of conflicts that arise while discussing the budget?
Oh yes. Oh yes. One of the most memorable ones that comes to mind, in 2019, we were discussing trying to raise the minimum wage. We were pushing really hard. We could not get it through. But at the same time, they were lowering the minimum age for students to have to go to school. Right now, it can be pushed up to 8 years old. This moved it to 6 years old. And there was a lot of conflict in the Republican caucus over that. So we sat on the floor waiting for them for almost an hour, maybe longer. Eventually, it was funny because the discussion was minimum wage and minimum age. But it's surprising. Like, we were almost done, almost through, going home when we finished that vote, and all of a sudden everything blew up over that little part. So that happens every year with different things, and it's usually a process that is drug out over a couple of weeks.
Yeah, and I know you touched on education. That's a big priority of yours. Mm-hmm. How are the children returning to school? How's that panning out currently?
So far, I think it's going well. From what I'm hearing from students, they're very happy to be back in school. Teachers seem to be happy to have students there, and we're very appreciative of all the students wearing masks and all the distancing. And I have not talked to my superintendent since some of the more recent changes, so we'll see how that goes. But I know that schools are starting to plan graduation, and they're all very excited about that. And it's going to look different still a little bit, I think, at each district. But things are getting more and more back to normal, which I think is a positive for everyone. Absolutely.
That was actually one of my questions. Has there been any big happenings in the COVID-19 pandemic from a legislative perspective?
Well, not from really legislative perspective, beyond that we are working on the budget, and a lot of that American Rescue Plan money has to be spent towards things impacted by COVID. So that's what we're sort of assessing right now, how badly has everything been impacted. But in terms of the guidelines, we do know that the most recent change from the CDC, and this continues to change, so I'm sure by the time viewers are watching this, or maybe even more updates, but most recently, they just announced that if you are vaccinated, you do not have to wear a mask inside or outside, which I think is a big change for a lot of folks and a welcomed one. And if you're not vaccinated yet, you still do have to wear a mask. So I encourage those who have not yet gotten it, please get it. And children have just been approved for the Pfizer vaccine. And so Delaware County is starting that. I would definitely check with the county on age restrictions and any other health considerations that parents should take, if there are any. I haven't read enough about it because I don't have children yet, but it's really good news. And I know that now we went from feast to famine from famine to feast with vaccines. So now there's walk-up, drive-up appointments available in the county. You can get any of the vaccines. All three of them are here. And we're finally at that place where it's easy to get. You can even now text a number. The national government just announced, federal government just announced, you can text a number and find the closest site for you to get a vaccine. So I really hope people who are waiting go get it. And once we get to 70% of vaccination of adults in Pennsylvania, we will lift the mask mandates in the state as well. Or the governor will.
Good to know. Okay. Yeah. Switching gears, I know you're working on a bill for affordable fertility treatments, which is very important to so many families in America. So tell me, in Pennsylvania especially.
Yeah.
So tell me about that and what the bill includes.
Yeah, so I have not really been shy about talking about the fact that I myself am undergoing fertility treatments. And it has not been an easy road and still not successful, but we have hope that it will be one day. But I've been very fortunate because my insurance covers most of the costs. There's still costs, and it is not cheap, but we're able to make it work between myself and my husband's insurance at the VA. But what I've learned during this process is there are tons of women and families struggling to pay for fertility treatments, especially if you have to take the route of IVF or in vitro fertilization. And women are choosing to work at Starbucks part-time, 20 hours a week, because Starbucks gives fertility insurance. They're traveling to other countries to pay less money, and they're really struggling with saving for retirement because they're using all their money now. And for some of them, it doesn't ever work. And so what we have started to do, myself and two other state representatives, Sarah Innamorato from Allegheny County and Steve Malagari from Montgomery County, is write a bill that would require insurers in the state of Pennsylvania to offer fertility coverage in their insurance policy, and to make it a mandate that the state has to follow. Other states have done this, and there's definitely pushback, but it would cover a certain number of cycles or amount of money for fertility. It includes, our bill includes surrogacy as well, and it also includes not just married couples that are heterosexual. It includes all couples, same-sex couples, or women choosing to pursue this on their own. So it's very encompassing. And we wrote an op-ed about it a couple weeks ago during National Infertility Awareness Week in April. And I was really surprised by the feedback that I got. I heard from a lot of people, constituents and other folks outside of the area, who have been impacted by this or have children who are impacted by this and are really glad to see something happening. So we have to do a lot of work now to try and actually get this bill passed, but we're really starting that conversation. And I think that's one that I've realized is important and needs to happen.
Yeah, absolutely. And the fact that the bill that you guys have written up is all-encompassing for all couples is very important.
Yeah.
And I think that's awesome.
Yeah.
Yeah. So has there been a lot of pushback from your peers when you're addressing this as well?
Yeah, definitely. Yeah. And it's for different reasons. Some folks don't think it's, they don't like mandates on anything. Some folks think that it's not affordable for employers. Although I know many employers that do offer this, so I push back there. And there's also those who feel like IVF is not something that should be covered by insurance because they don't support it, which we definitely disagree on that part as well.
Yeah, it's definitely a complicated situation when it comes to that, but I always say as more people go to college and they're in more debt before they can even start their lives, that they can't start families until they're a bit older. So I think this is a very timely time to introduce this bill.
I agree.
As more people struggle.
I agree.
So what are some other bills that you've been working on? I know you have an event coming up with Senator Cappelletti in Radnor Township. Can you tell me about this SHRED event?
Oh yeah, so we are busy in Harrisburg, but also now in the district as well. So on June 12th at the Radnor Township building, I believe starting at 9 a.m., but you can confirm on our website, repomara.com, we're hosting a free SHRED event, a paper SHRED event. And so I will be with Senator Amanda Cappelletti, who is the newly elected state senator for this area. And we will have the truck on site. Residents can drive through. We'll take everything out of your car. We ask people bring up to 4 bags or boxes of paper. And it's to help make sure we protect folks from identity theft. And also it's good for the environment. So it's a win-win for everyone. And it's a free event. So Radnor Township Building, June 12th, 9 a.m.
Awesome. Sounds good. So when will you be able to meet face-to-face with your constituents? I know you did have an office in the Radnor Township building that you were there once a month.
Once a month.
Once a month.
So we're waiting for the township buildings to signal to us that we're allowed to come back, but we do intend to, I'm hoping by the fall, have a staff member back in the Radnor Township building and also in Morton Borough Hall once a month. And we also are starting to have in-person, we've been having appointments in the office, so people have been coming into the office for months now, since last year. but they had to be scheduled. So we're looking at now, after the restrictions are lifted, to opening the door again, so you don't have to schedule an appointment, although they always help. And I will be able to take in-person meetings after May 31st. So we are still asking folks who aren't vaccinated to wear a mask in the office, and that is not only for my safety, but for my staff as well. And we're excited to start to figure out how to have events again. So that's a longer conversation, and one that we're not quite through yet, but we are starting to think through our plans for the rest of the year.
Right, we'll get there.
Yeah.
I know this past week, as we sit here today, we did celebrate National Police Week.
Yes.
And we went down to the Radnor Township building, got to speak with them. So did you participate in this in any way?
I did, actually. And I've been doing this every year since I got elected. I bring the police departments, I have 4 in my district, certificates recognizing National Police Week for every police officer in the department. And last year I started bringing lunch with me, so I have to keep that tradition going. So I was in Radnor on Wednesday this week at 7 a.m. for their roll call shift change. So I was in there when they were getting ready for the day, and I brought them all bagels and coffee and donuts. And,
oh, very nice.
Yeah. But lunch I've been bringing to all the other places. So I just came from one before filming this.
Did you?
Yeah.
What was that like?
I brought pizza, wings, and fries to Morton Police Department, which was nice because they were working on setting up for an event, and everyone got to take a break and eat. So. Yeah.
Nice.
And it's also been great because I get to support small businesses while doing this. So I have been trying to buy from a different small business in the area when bringing food to one of the departments.
I want to circle back to the issue of not the issue of education, but the topic of education. I know in one of our episodes previous, we did discuss affordability of education, especially higher education. So has anything been passed further with that you were working on?
Well, we haven't had any legislation passed, but the Student Debt Caucus is reforming, and we are having our first meeting at the end of May. So by the time this airs, we will have met. And what we're really looking to do at that meeting is review the legislation that we have authored together, myself and my co-chair, Rep. Megan Schroeder, the Student Borrower Bill of Rights. We're trying to gain more co-sponsors to get attention around it. And then we're also going through the bills that have been introduced this session, all related to higher ed, and then figuring out which ones the caucus really want to prioritize and focus on. So we're trying to restart conversations that were sort of paused because COVID-19 had consumed all of our work.
Yeah, definitely. Yeah. What do you think the odds are? Do you think it's probable that any percentage of student debt will be taken care of?
Well, that will be decided at the federal level.
Right.
So unfortunately, I won't get to decide. But it does seem like it's a legitimate conversation that is happening now. And I know that they've talked about sums like $10,000, $50,000, all of it. I think we will see something happen. I don't think it'll probably be all of it, but we'll see. And I feel like anything they do end up accomplishing is going to help so many people and will stimulate the economy in a lot of different ways. So
Definitely.
I hope they do continue to pursue that in Washington.
Yeah, me too. And I know that you work on so many different things, not just the few that we discuss in our episodes here. Is there a bill or anything that you're working on currently that you'd like to give us a sneak peek to?
Well, I will share. It's not my legislation per se, it sort of is. So last session, I wrote a bill that would increase the amount that you can donate into the Veterans Trust Fund when you interact with the DMV, which I just did the other day when we're registering my car or re-registering. And so last session, I introduced it. It passed out of the House, but it did not pass out of the Senate, unfortunately. This session, I've reintroduced the House version, and we have had a committee vote. It passed out of committee unanimously. But a senator wrote the same version of my bill in the Senate, and that bill has passed out of the Senate and out of committee in the House. So now we're waiting for a final vote on the floor. So if that happens, which it most likely will, a bill that I wrote, even if it isn't my exact version, which kind of happens sometimes with the House and the Senate, will be presented to the governor for signature. So I'm really excited. I hope it happens. And I hope we're able to go back, when we're back in Harrisburg in a couple weeks. I hope it's on the agenda.
Yeah, that's very exciting. Congratulations.
Thank you. We're a little early, but hopefully. I mean, it'll be a great thing for veterans. The Veterans Trust Fund is a statewide grant program that supports any veteran in Pennsylvania with the DD 214 through veteran service organizations or your county veterans department, and that's where all this grant money goes. So it never has enough money to meet the demand, and so we're hopeful to build more revenue for the support of veterans across Pennsylvania.
Great. I'll be excited to talk more about that in our upcoming episodes
Sounds
too,
good.
if that passes. So I know you love to make yourself available to speak with your constituents about their issues and help them in any way that you can. So if you could just run through how people can get in contact with you very quickly.
Best way is to call the office. Our number is 610-544-9878. You can also email me. And you can do that at repomara.com or by emailing me at repomara@pahouse.net. Less quick, but still happens, is through social media. I have people who send me messages on Facebook and Instagram, and I don't always remember to check them, but I do my best. And so if you message me there, eventually I will see it, and someone, either me or someone from my staff, will get back to you. But definitely encourage people to call if it's an urgent need, or contact us by email if it's something that can wait a little bit, and we'll be definitely back in touch.
Great. Well, thank you so much for being here with us today,
Thank
Jen.
you, Morgan.
I appreciate it. And thank you for joining us today. Like I said, Jen makes herself readily available to anybody that she can be of assistance to. So if you have any questions or concerns for Representative O'Mara, please visit her website at repomara.com, where you will find her contact information that she has listed here today. Until next time, thank you for watching.